An Australian legend, Associate Professor Rosanna Capolingua has sat on more boards than you can count and truly embodies the phrase, well-rounded. Rosanna was AMA's president from 2007 to 2009 and has also been a member of the executive of the Federal AMA, chair of Federal AMA's Ethics and Medico-Legal Committee, and currently sits on multiple health boards at a state and national level. Amongst all of these roles, she is also practice principal at Floreat Medical, a general practice in WA near the area where Rosanna grew up. We are incredibly excited to welcome her to Convention 2018, where we hope her achievements and career will inspire the rest of WA's medical students, of Australia's medical students, I should say, as she has done for us.
Everybody, thank you very much. Well, I must say, it's a great honour to be asked to come and talk at ANSA Convention. Really a great privilege. It's also very high pressure because I've got to keep you engaged for a while, so I'm going to do my very best to do so. The talk today is called Against the Tall Poppy Syndrome, and we're going to tackle a little bit of that, and then we're just going to talk generally, I guess, about the things in life that you may encounter as doctors, and certainly the things in life that I've encountered in my time as a doctor. But I've actually got 3 take-home messages that I'm going to give to you at the beginning, so that if you get bored and walk out, then at least I've delivered something, I hope, worthwhile to all of you. Message number 1, when you're thinking about the tall poppy, you know Australians are very good at taking down tall poppies. And even the fact that you've got into medicine, and I don't want you to feel elitist, because you're not, okay? Even the fact you've got into medicine means that you're a bit of a tall poppy already, and that carries great responsibility because the humility in your role is incredibly important. Australians are very good at taking down the tall poppy, and let me tell you, doctors are very good at taking down each other. And in a competitive environment like you're in now, as you graduate and looking for training positions in the future, you watch out for those that want to take you down, and don't be the person that wants to take your colleague down. The best way to take down someone is to actually make up lies about them, to fabricate a scenario, to misrepresent, basically to tell untruths. And let me tell you, the most difficult thing to defend yourself against is other people's lies. Lies are particularly useful if someone that you're attacking with, or attacking with the lies, I should say, has great integrity and honesty and really is selfless and has only good intent. Then, if you lie about their integrity or their honesty, it's very easy to take them down. And if you try and defend yourself against those lies, you actually have to swallow the hand grenade, as we call it in media training. So if someone says to you, and this is a completely random example, "You abused your wife on Saturday night, did you not, John?" And John answers, "I did not abuse my wife on Saturday night." John has swallowed the hand grenade. The grab and what everyone hears and sees is John denying that he abused his wife on Saturday night. So sometimes to fend off the lies that are taking you down, you actually have to be silent. And it's very hard. You've had your credibility and your integrity taken down, and then you can't even defend yourself, because in the defence, you look as though you're protesting too much. And that has happened to me on a few occasions in my life. I can tell you the worst one just a few years ago, which really made me silent for about 2 years. This is the first time I've stood in an audience this size for nearly 3 years, I should say, because of that attack and assassination. So that's number 1 message. Number 2 message is we are very concerned about discrimination. You in particular, as young medical professionals to be, very concerned about equity and equality. And so we should be, because as doctors, we don't stand in judgment of anyone. When people come to us, we're there not to make an assessment in our personal paradigm of who they are. Everyone has their own story and comes from their own place in life. Each and every one of us, even me, you could make judgments of me, that's fine. When we're not to do that, we are to be there to support, to listen, to care, to guide, to endeavour to make that person's life better, health-wise, spiritually, psychologically, mentally. That's what we're for, as what we're meant to do as doctors. So that is the base of our non-discrimination. But at the moment, there is so much righteousness about not discriminating that the righteousness itself is creating discrimination. So you're not allowed to hold a different view because you get taken down for it. And I implore you as doctors to be, not to become righteous, not to preach, to listen, to feel, to hear, to influence change for the better, but don't become righteous. Okay, that was message number 2. Message number 3, and I promise you the whole thing's not a lecture, there is a bit about my life. Message number 3, you're in a very competitive training environment going forward, very competitive training environment right now as medical students, let alone getting intern positions, RMO, and into your college training programs, whatever your heart desires, as it used to be. Now it's even harder. And the encouragement is very much for you to do research, to have papers, so that you've got things on your CV, and agreed one should be invested in that. And of course community activities, so that you demonstrate that you are a good citizen, that you're able to be the professional, ethical person who has a responsibility for the community and for society overall, which is what we should be. All of that is very necessary, but do not compromise your clinical experience in that journey. By the time you guys are out there trying to get into college training programs, the colleges will swing back around to what are the reports about the clinical hands-on experience of these young doctors. I think Fiona mentioned it, never waste a minute in time. Every time you're out there in the hospitals, in the outpatients, in theatres, in a consult room, out in the community, and you've got patients around you, invest yourself in it. Use it all. Make sure you get the balance right. All that knowledge that you're learning behind in your lectures and your texts and tutorials, whatever, that all gels when you start to see people, when you see the patients, when you're relating to them. And every opportunity that you have a patient, you should observe them, see them in their entirety, listen to them, learn how to take a good history, because most of the diagnosis comes out of the history and it certainly directs you in where to go. So that's about hearing your patient as well. And then don't forget to lay on the hands, certainly in examination, but touch them. Embrace them, in inverted commas. You don't have to hug everybody you see, but embrace them. Give them that sense of human warmth, comfort. It makes them feel confident in you. They actually reveal more to you. And if that happens, you will be able to help them even better, even more. So they're my 3 take-home messages. You got those? You can leave now. No, don't leave yet. You'll stress the people out the back. I believe you got a morning tea afterwards. So I'm the daughter of economic refugees, Italian migrants, would you believe? My parents came here, couldn't speak a word of English. I'm the 3rd child, a son and 2 girls. Of course, Italians, the son is the golden child. The middle girl is the first girl, that's great, and then there's me. However, I do feel that I was very much loved and nurtured and had a safe environment when I grew up, so I am very grateful for that, and I loved being a child with an extended family in that very protected and sheltered Italian sort of environment. By the age of 5, I decided I wanted to be a doctor. My father had a small farm and he was a bit of a vet to the animals and a butcher as well, and I was tagging along beside him all the time, so I knew a lot of anatomy by the time I was 6, pretty much. So I wanted to do medicine, got to the end of year 12 and didn't get the aggregate to get in. So a lot of you probably know that feeling. So lots of people said I should go and be a science teacher. I was probably aspiring too high anyway. My parents certainly were not going to pay for tertiary education for a girl. Luckily for me, the Whitlam government was in and it was free. They would pay for my brother, but not for me. We all went to tertiary, went to university. So I did 2 years of science, and there was no way in the world I was going to be dissuaded from my path. Pretty independent, stubborn sort of individual, and managed to get into 3rd year medicine with exemptions for everything for the first 2 years. There I was, all good, but I was already an outsider. You guys can be pretty cliquey, you know. There are definitely cliques in medicine and they live long. and prosper over the decades. But we are all colleagues, okay? So remember that. So I was a bit outside. That was fine. It's never worried me. It's always made me make my own decisions. I guess not terribly influenced by the peer group. Don't really care what everybody else thinks. Otherwise, I probably wouldn't have done a third of the things that I've set my neck out to do. But I had a partner from high school. We got married in 5th year of a 6-year undergraduate course. What happens when you take a progesterone-only pill and you're not breastfeeding? You get pregnant. So, I had a baby due in the end of July of my final year of medicine. Now, there was a huge amount of pressure for me to terminate that pregnancy, to the point where I was gowned and sitting on a bed prepped for theatre at the maternity hospital here in Perth. And my obstetrician gynaecologist, who'd actually been a registrar that had been with me when I was doing my O&G rotation, came in, opened the curtain, and he looked at me in my socks and shower cap and gown and said, "Rosanna, you don't want to do this." And I went, "No, I don't." He said, "Go home." I now have 3 grandsons from that baby. And she's also an emergency medicine physician with a dual fellowship at the College of GPs, a diploma in O&G and a master's in public health, and she has 3 little boys. And the middle one turns 3 today, and I'm going to go and see him after this. So, decisions in life. Then, of course, I went back to my last surgical rotation. I had her induced on the Saturday of my week off. You know, that week you get off. Social induction. Went back when I was 9 days postpartum. And we're doing a ward round late in the afternoon, standing bedside teaching, and the surgeon asked me a question, and I burst into tears and ran away. Literally, ran out of the ward, ran to the car park, got in my car, drove to my mother's house, picked up my baby and went home. And then I gathered my senses and thought, oh. So I rang him and apologised. And I said, "You know, you don't know, but I've just had a baby." And he said, "Well, it's too late. I've reported you to the professor of surgery. You're going to have a meeting with him and explain yourself. You think you've got prejudice and discrimination now. You guys don't have no idea." So off I went, made the appointment, and saw this very austere gentleman. I'm trying to avoid using names so that we don't, Very austere chap. Explained to him that I just had a baby and, it was just a bit whatever I was at 9 days. And he looked at me and he said, "Well, my dear, you've got yourself into a pretty pickle. It's about time you gave up now. Stop wasting the taxpayers' money. You're never going to amount to anything." Well, that worked because I thought, well, I will do what I need to do. And I did. Baby in tow, breastfeeding. I had her induced at the hospital where I was doing my surgical rotation so I could go back to the nursery with my breast pump. Sorry for using the gestures, but if any of you remember the old-fashioned, now they're all automatic, you press a button and it happens, but you used to have to, God. I've got post-traumatic breast pump disorder. I seriously have. Anyway, I did it with this child in my arms. And then, of course, when you do that, you become an intern, don't you? And what do? You work 60 to 70 hours a week in those days. I know it's like fish and chip paper and all that sort of stuff, 60, 70 hours a week, sometimes 80, 90. You could start on a Friday morning and work right through until Sunday night and then go back Monday morning if you're on call for it was the Repat Hospital back in those days, Hollywood now. You're on call for the whole hospital for that period of time. I had photographs of my daughter we used to wear white coats. Now you can have them on your phone, of course. Photographs of my daughter in my top pocket. And every morning when I dropped her off, I used to turn up the radio really loud so that I didn't cry too much on the way to work. I survived. But let me tell you, we do it hard. And as women, we do it hard, and I'm sure men do it just as hard. And it's really good when we do it together, because then we share the challenges and the difficulties. But at the same time, nurturing and loving and giving our children a safe and confident environment to grow up in is incredibly important, because that is the real legacy that you leave in time. So I did internship and my RMO at St Charles Garden Hospital, and my partner at that time had got into dentistry, and it was his final year of dentistry, and he couldn't cope with a 18-month-old, 2-year-old at home, so I had to leave the hospital. At that time, Sir Charles Gardner actually offered me rotations that would work with family. Can you believe they did that so long ago? We struggled to get them to do it now. They're just learning again. Must have been a unique bunch of people back then. But I felt that it wasn't fair on my partner, and I started in general practice. And you could just hang your shingle up back in those days. Obviously, I went to work with someone. I did enter the training program in general practice. I do wonder what it would have been like if I'd stayed at the hospital. What would I be now? Even though I love my general practice, you really have to be the total physician when you do that. But it's very demanding work. Out into general practice in the training program, and child number 3, of course. You've got to have a sibling. So 3 years later, I'm 20 weeks pregnant, and my training supervisor walks into the consult room. Rosanna, what have you done? You're pregnant. I dropped out of the program. I thought, you guys just don't get it. So I don't have still my FRA CGP. It was offered to me later, just I could sign a form and just have it, and I thought, I haven't justified, I haven't finished the training, so I didn't accept it. So too bloody principled is not a good thing. I should have taken it anyway. I should have taken the offer. It doesn't matter. It hasn't stopped me from doing what I wanted to do. And then the next step, I guess, is how I got into the AMA. Vocational registration, there's differential rebates. You may not get this stuff, but the government was interfering with medicine, as it always does, because if you pay the purse strings with Medicare, you've got to have your fingers in the pie to manipulate things. And they were paying a higher rebate to doctors that were vocationally registered and a lower rebate to doctors that weren't. And for me, I could see that the government was splitting the profession. They were creating 2 tiers of doctors, and I was annoyed. I'd done public speaking at high school, and I was into general practice education, so I went along to a meeting. I'd been a member of the AMA from graduation, and I was reading, their journal here. Went along to a meeting at PMH with regards to this issue. I stood up and said something. Someone spotted me. I got fed back into the AMA council that this girl with a funny name with lots of vowels had stood up and said something, and then I got a phone call from the state president inviting me to come on to the AMA State Council. And I said to him, but I'm busy, I've got 3 kids. Oh, I'd had another kid by then. I've got 3 kids, and I'm on the PNF at school, and I work, and he said, that's exactly the sort of person we need. I thought, I can't fit anything else in my life. How wrong was I? So I accepted the position, and over that period of time then, I learnt a lot, listened a lot, developed a lot. I have always, even as a GP, really wanted to know and understood the whole health system. It's about, not for me, just, I shouldn't belittle general practice, I'm not just the wedge of general practice. It's public sector health, private health systems, public health and prevention, the political aspects, funding, models of care. So for me, it's always been about the big picture, and there was a huge learning curve, but by the time I was 38, 39, I became the youngest and the first female president of the Australian Medical Association in Western Australia. And I'm still the only one, girls. Still the only one, because it's not easy when you've got kids. So my kids at that stage would have been, 16, what's 3 years from that, 13 or so, 12, I don't know, and then 10 or something like that at that age. I was still married at that time. There's a lesson in all of that too, isn't there? And so I guess it was handy to have a husband at home, but I ran my presidency of the AMA in school hours. So I still took the kids to school, still picked them up, had all those conversations that you get at the end of the day, and give them afternoon tea, cooked meal, and then we'd have meetings in the evening as well. So it can be done. You just have to doggedly say, I will not attend a meeting at 3 o'clock in the afternoon. It's not going to happen. Wipe that out, because I've got other things to do. So the balance is important. You work your butt off, but it's very rewarding and very fulfilling. So in that time after that, my marriage broke down. We had a combined dental and medical practice. I had 3 kids at home. I had to set up my own surgery, which is, I'm very proud to say, Floreat Medical now. It's been a labour of love and I'm very, very proud of it. But I managed to do that and continued. And any of you who come from families where there's been a separation, a breakup, a divorce will understand, I don't need to describe how challenging it is for the 2 at the top, but for those children, whatever age they are. Anyway, I continued. Now, I had developed quite a high media profile as state president of the AMA, and then that continued the whole time. I was sort of the go-to person for the local media and a bit of national media around general practice and everyday clinical stuff, and also still a little bit on the political front, and developed also very strong public health advocacy, you know, tobacco, obesity, alcohol, drugs, immunisation, those, a bit of the environment, those sorts of core issues that we as doctors are about in helping prevent people from getting sick and influencing government to make changes to the environment, to the community, to enable people to make healthy choices for themselves, to support all of that. In that period of time, then I became federal president of the AMA. Now, when I ran for federal president, it's not an automatic thing. At both times I had to stand for election. Federal president, you spend all your time in Canberra. So the criticisms leading up to the election were, she's a woman. There'd only been one other woman at a federal level, and that's Karen Phelps, a colleague of mine who had been there a few years before. Some of you may know Karen from national media. But she's a woman and she's from Western Australia. How many people have flown here from, you know, Sydney or Melbourne or Canberra? Yeah, oh good, welcome. Yeah, do that every week, backwards and forwards, backwards and forwards. I was Qantas's highest flyer for 2 years in a row. So that was a good takedown. She can't do it. She's got children at home. They were, you know, senior teenagers by then. 2 of them doing medicine, 1 finishing school and getting into medicine at that stage. And the other thing they used against me, now I have a confession to make. We'll see who walks out of the room. I'm a Catholic. You guys okay with that? People from Notre Dame might be okay with that. Don't discriminate against me. To me, my religion means respect and compassion for fellow humans and the environment. That's what it means to me. But I'm a Catholic. So when I was running for federal presidency and the candidate was from New South Wales, they spread the rumour around that I'm a Catholic, Tony Abbott, who was health minister at the time, you all know him, Catholic, Rosanna and Tony had done a deal to remove the Medicare rebate for terminations of pregnancy if she gets elected. That's the kind of bullshit people put out about you. Yeah. Lies. She's a Catholic, she's going to do this. She's a Catholic, she's going to do that. She's a member of the Liberal Party. Heaven forbid. Anyway, honesty, integrity, staying on message, engaging with all parts of the profession, knowing what I was talking about, that probably helps. And I got elected federal president of the AMA, which was a great privilege and an honour and a huge learning curve, mind-expanding experience. I learnt a great deal. Now the time has gone to 00. Does that mean my 20 minutes is up? Because I haven't got very far. No, I have got a long way. So federal presidency is a national stage, an international stage. I was the Australian delegate to the World Medical Association, helped Mukesh Hakala, my colleague and the president before me, become president of the World Medical Association, which was great, and lots of colleagues overseas and great experience. So when you embark on your path in medicine, you can do all the wonderful things that Fiona has done. You can take a path which is a medico-political one, like mine, I guess, but still have the clinical foundations I practice every week and did the whole time, regardless of what I was doing, because if I'm not connected to the patients and not connected to the clinical work, I don't think I'm authentic. I'm not genuine. How can I stand up here and pontificate about anything if I'm not real? If I'm not understanding what today's issues are? How patients navigate the health system today, what they're confronted with, what today's health issues are. So the clinical stuff grounds you. The rest of you can be expanded and you have many pathways and many choices. It's wonderful fun. So my media profile was even bigger then and continued to be a very strong public health advocate. And in WA, there's a health promotion foundation called Healthway, which is just about being completely destroyed by the previous Barnett government now, along with my reputation. And so I was on that board for 10 years and then became chair of Healthway. Healthway was born out of this state government legislating to buy out tobacco sponsorship of sport. You guys don't remember when tobacco was all over everything, because we've done such a good job with it. But this foundation was created out of that legislative effort, and it continued that, so it would sponsor Marlboro racing cars. Used to be Marlboro, but then they've not been that for a very long time. For instance, even I can't remember what they were. And it moved forward beyond the legislation to buy out alcohol sponsorship of sport. So here in the cricket, we used to have a big net on the side of the whacker to keep all the drunk people in, because they used to throw stuff on the ground and run around and things like that. We don't have that kind of behaviour anymore. We bought alcohol sponsorship out of cricket in Western Australia, and they've got a branding called Alcohol Think Again. So it was about community messaging and prevention. And similarly, we push back against junk food advertising and promotion, particularly with kids. And obviously, and we were really pushing when I was chair, as you can imagine, I would do that, all within the guidelines, but the state government didn't like it, the Premier didn't like it. He was lobbied very heavily by Carlton United and Coca-Cola Amatil. A lot of the sporting people, you know, they used to say that if you take tobacco out of sport, no kids will ever kick a footy again. So the alcohol industry is saying, if you take alcohol out of sport, there won't be any football, there won't be any junior football for anybody. Denying children, denying the alcohol companies of this big market, growing market. If you impregnate the kids, they're going to be drinking for a long time. Same thing as the tobacco people. Same thing with the junk food. So the Premier decided he needed to take control of Healthway. Unfortunately for me, I had a CE who was very vulnerable to having his ego stroked by people in the department or the government. And he also had, I'm bound by confidentiality, I have to be careful here. Okay, he was doing stuff that probably wasn't the right stuff, let's just put it that way. And as chair of a board, you're responsible, and the board's responsible. Now, I knew the previous Premier quite well, kind of personally, and we had I called for an investigation into Healthway, and the investigation revealed there was use of tickets by staff and members of the board to attend these venues. So I'd been on the board 15 years, I'd been chair for 5, I'd been to 7 events. As chair, I'd tossed the coin at the netball, I'd given people at the opera a lecture about drinking. Do you know the stats show that women who attend the arts functions drink more wine than women who don't? That social group, would you believe, are higher risk of alcohol abuse. So I gave that kind of talk, a few grumbles from... That's the sort of thing I was doing. It was reported for 7 days in a row in the West Australian front page that I was the rorter. The Australian said that I had rorted $220,000 worth of personal benefits out of Healthway. I was bound by a confidentiality agreement around the removal of the CE and bound by the Tobacco Control Act not to defend myself. All I could say is that I've never been a user, and I haven't in my whole life. My credibility publicly was completely shattered. I had patients coming and saying to me, you can never stand up and talk about alcohol or obesity again, Rosanna, because who's going to believe you? You rorted. My mother said to me, if you needed the money, why didn't you ask me for it? So a bunch of lies. Front page here, national news, in the medical press, former AMA president, blah, blah, blah. Very painful experience, I can tell you. And this is really the first time I've spoken about it like this. So, you learn lots of lessons, even from something like that. It has silenced me for a while. I'm trying to find myself again. It's an interesting experience. And, I started this conversation by mentioning humility. And humility is something you should learn every day. And I try, and I've always believed that I have tried to do that. But this was a very big lesson. I was in Sydney when the story broke at a meeting. I'd been to something. And seeing what was coming out, I had to say to myself, This too will pass. My children are healthy, safe and well. The people I love are healthy, safe and well. It's something I say every now and again. Please don't get offended, anybody, but when someone is sweating the small stuff, I go, have you got cancer? Who's got cancer? Have we got cancer here? No? Who cares about the small stuff? So perspective and reality is a very important part of life if you want to be able to keep going. Now, it says, please allow time for Q&A. So I better do that. There are so many more things I could share with you, but I guess what I really want to do is wish you well. It is a privilege and a unique experience to be able to do what you are doing. Enjoy every minute of it with great passion. There'll be ups and downs. Look after each other, look after your families, and I hope I see you through the courses of your careers. Thank you so much.
Thank you so much. That's wonderful. Thank you so much, Rosanna. You can see why we invited her here today. She has such a plethora of experiences. So I've had a few questions via the app. I think we'll only have time for one of them, I am afraid. So this question comes from Brittany Wicksteed. Do you think barriers are breaking down for women in surgery? How can it continue to improve?
I think they are breaking down, but geez, we've got a long way to go. And it's not just about the systems, it's about the attitudes. And as I said earlier, we do it a little bit to each other, even in this arena. I see women going to the men first to be introduced or shake their hands or whatever. There could be a female, a colleague in high standing or position. It's happened to me. And you know, whatever the male counterparts will be the one recognised rather than the women. So to break down the barriers overall, we've got some really grassroots, simple concepts, paradigms to shift. So keep at it, everyone. To the women in the audience, don't use breastfeeding as a platform because it's been done before. We've all breastfed, remember me and the pump? We haven't all breastfed, but I think that there needs to be a lot more to our equality than things like that. A lot more. It's a playing field that has to be equal in all of our minds, women and men. Sorry, I stood up again. Shall I sit down?
So how do you propose that we do that?
It's a cultural thing. So it goes back to that bit about non-discrimination. It's about equality. You know, the conversations we're having now about gender, I think as doctors the way to handle that is that we should elevate ourselves to the person so that it doesn't matter all of that other stuff. It might need a particular bit of medical care or understanding or insight, but we are looking after the people, the person. So it's really about elevating our minds to a whole other level. But when there are systems in place that have been entrenched for many years, it takes time. And calling things out now, I think, is an important part of it. Job sharing abilities is incredibly important, and supporting all of us in our endeavours so that we can practice really brilliant medicine, but be great human beings as well.
Thank you so much, Rosanna.
My pleasure. Okay.
I have a small token of our appreciation.
Thank you very much.